Good morning, Barry. It's Mayor Jeff Lehman here. I'm working from home like so many people these days. So we certainly live in interesting times. These are very unusual times in our city, and I know there's a lot of change that everybody's trying to deal with right now. Obviously, with the spread of COVID-19, governments at all levels are trying to work together to protect the public. And you probably heard a lot recently about flattening the curve. So what's that about? Why are we social distancing? Why are we working from home? Why are you seeing things close? This is because all levels of government are following the advice of doctors, scientists who work in public health. And that's the first message that I really wanted to get out. We need right now to be listening to the people who have been thinking and preparing for these kinds of situations for years. That's what public health does. That's what epidemiologists do. They've been preparing and making plans for this kind of a situation where we know that people's behavior, what we do in our daily lives, what our economy does, that's going to affect our success in combating this kind of virus. So what you're seeing right now with these changes, and state of emergency has been declared in Ontario, a whole bunch of businesses have been told to shut down, others are choosing to shut down. That's because we need to practice what's being called social distancing. That is literally not gathering in large groups for any reason at all. That's to help limit the spread of the virus. And we're also being told, and I want to reiterate, it is so important, wash your hands and do it for a long time. Don't just run them under the water. Don't just put a little soap on, like wash your hands. We talk about singing happy birthday through twice while you're doing it. That's how you know you've done it for long enough. Be careful about your contact with other people. When you touch surfaces in public places, come home, wash your hands right afterwards. These are all measures to limit the spread of the virus. And you've heard the expression spread, or at least flatten the curve. The reason we are trying to flatten the curve is to allow our healthcare systems to be able to cope with the impact of COVID-19 should it spread widespread in Canada. What that's about is delaying the onset of the virus, delaying the transmission of it among people in our community. So number one, hopefully a lot fewer people get it. That's the main goal. Number two, if people get it, to slow the rate at which they get it so that our hospitals, our clinics, and so forth are able to deal with the demand that creates on the system. This is something where we all have to change our behavior, and it can be a struggle. It can be scary. It's going to result in people having to, cancel holidays, cancel trips, cancel events. You've seen all these things happening in the past week here in Canada and in Barrie. It's also going to be tough on people who really don't have a lot of connections. They don't have somebody that they're living with. They don't have somebody who can help them with daily tasks. So for those who have to self-isolate, stay at home because of their potential exposure to the virus, they're going to need help, and we're going to need to help one another. What makes that even more challenging, of course, is limiting contact. So one of the wonderful things I'm seeing right now, and we're seeing this across the country, and particularly in cities like Barrie, where people really care about one another. People are reaching out to their neighbors, their family members, calling them, texting them, Facebook. We've got all these tools now to communicate with one another and saying, are you okay? Do you need anything? We've had 2 Facebook groups in Barrie that have thousands and thousands of people that have joined just in the last few days for no other purpose than to help out one another with things like picking up food or picking up medication. Drop it on the porch, drop it at the door so that the people who are self-isolating or who need help can get it. I want you to know as well, your city government over the last 4 or 5 days has been doing almost nothing else than focusing on what we can do to flatten the curve and reduce the impact of COVID-19 here in our city. Obviously, we've made a whole bunch of big changes in terms of city services. We have closed almost all our public facilities. We've implemented some new standards and approaches to how we deliver other essential services like public transit. All of these are designed to keep our city operating, keep all those essential services operating, and rest assured, water, wastewater, police, fire, ambulance, we're continuing with our transit service. These services are all still being provided. Our staff are doing an amazing job, even sometimes in tough situations, to make sure everybody's safe. And, with the decline in travel and business activity, um, the city may seem quiet, but I can tell you all of our services, all of those essential services continue to be provided to the public. We're going to keep doing that, and we're going to continue to try and work now as we enter this phase of social distancing and people being at home and businesses not being many businesses not operating. Now we're kind of shifting to how do we get through this period of time over the coming weeks and make sure everybody gets what they need. So yesterday I formed two task forces, one called the Economic Support Task Force, the other called the Social Support Task Force. Economic Support Task Force is going to be about helping businesses, those who are continuing to operate, to manage the impacts of the virus. For those that have shut down or have to shut down for a period of time, we're going to help them obtain support. The federal government has just announced a huge package of support. We want to connect Barrie businesses to that support as soon as possible. And if there are things we can do locally, helping businesses get online, helping delivery services expand what they do, we're going to do that to try and help people, try and help protect jobs, try and help minimize the impact of layoffs. And ultimately, when we, in the weeks and months to come, as the situation continues, try and mitigate those impacts on the overall economy. The Social Support Task Force is about protecting our vulnerable populations and doing what needs to be done to address the impacts of the virus for those who may not have the resources to address it themselves. So we're concerned about things like the homeless population in Barrie, seniors in Barrie, low-income families who may not have the resources to try and work from home if they've been laid off, if they're self-isolating. So that task force, which consists of many of the charitable organizations and social services in Barrie, what we're going to be about is trying specific measures to both ensure those services keep being delivered, things like the food bank, but expanding them for people who need it and dealing with the unique needs of self-isolation, for example, in the homeless population. Both those task forces met yesterday. We are growing, or even today, we're starting to grow our activity. And in the coming weeks, we plan to expand those efforts throughout the city to try and help vulnerable populations. All of this to say, this is a very unusual time. I mean, we do prepare for these sorts of things. There are pandemic plans out there. The healthcare system has prepared for this. We learned a lot from SARS 17 years ago about how to protect healthcare workers and deal with quarantine measures. But COVID-19 is a little different. This is a virus that spreads very easily in droplet form and requires all of us as Canadians and as Barrie residents to follow the advice of public health. I guess the last thing I wanted to say by way of this sort of statement is, our healthcare system, our healthcare workers are working incredibly hard right now. I spoke yesterday with the head of our hospital. They have opened an assessment center here in Barrie. You should only go there if you're experiencing symptoms of COVID-19. The assessment center is not, unfortunately, we're not able today to test everybody. The testing capability in Canada is growing, but our healthcare system needs to focus on people who are actually sick. So only go to the assessment center on Huronia Road if you're actually experiencing symptoms. There are online tools to help you understand whether the symptoms you've got could be COVID-19 or they could be something else. Of course, one of the challenges with this virus is the symptoms can look an awful lot like the common cold or even allergies. So take that online self-assessment tool, take care of yourself, and take care of one another. And most of all, folks, listen to that advice from public health. Unfortunately, in the age of social media, there can be some poor information out there. There can be a lot of fear mongering. What we need right now, most of all, is to listen to those trusted sources, those people who really understand what needs to be done right now to flatten the curve and manage these unusual times. And that's our public health experts, the ones that you are seeing in news conferences. And that's those trusted sources online, public health websites, government websites. All of us in federal, provincial, and local government are committed to working together. And I can tell you we're working together all the time to try and mitigate this. But look for that good information, follow the safe practices, and we'll get through this together.